Hi, it's Dr. Khanna talking to you about glaucoma. One of the important things in glaucoma we discussed was measurement of intraocular pressure because that can lead to damage of the optic nerve. And what we discussed was if it's just high pressure above 25, where normal being 20, it's called ocular hypertension, but associated with nerve fiber damage and visual field loss is termed glaucoma. So it becomes very imperative and important to measure the intraocular pressure accurately. The gold standard for all these decades has been very aptly termed Goldman applanation tonometer. It's reproducible and has been found to be most accurate. But there are some problems in using this equipment. And one of the first things you want to know is that you have to put drops in the eye, anesthetic drops, and stain. Now, a few decades ago, you won't believe, but optometrists were not allowed to touch eye drops. So scientists invented a horrible system for them, the air puff tonometer, which every patient has told us they hate it. And besides that, it's not accurate. So our progress has gone on because we are looking at four things important for the measurement of intraocular instrument. One, it should be accurate. Two, reproducible. Three, patient friendly. And four, lightweight and can be taken from one room to another or one place to another. So Goldman is accurate, but it has to touch the eye and there is some chance of cornea getting scratched, especially if you've had done LASIK and the flap is not well attached. And then Goldman applanation usually works best when it's attached to slit lamp, which is a bulky thing. And not everybody can be trained to use it. It requires a lot of experience. So enter our good friend, the eye care tonometer. It's pretty light. I'm holding it in two fingers. Even a high school student or a graduate can be trained to use it because it's very simple. There is a light. Red means no, green means go. See, green, go, red, no. And then it's brought to rest on the forehead. And the probe, which is very minuscule, it touches the cornea and comes back before even anybody realizes it. In fact, most of the patients don't even realize something touched their eye. This is reflex tonometry. In our internal studies, we found it to be as reliable as Goldman applanation and easy to be taught and can be moved from room to room, and patients love it. And best part is the measurement is digitally displayed here, so there is no guesswork. So if you have been scared of the intraocular measurements for glaucoma and have been avoiding to visit us, you can forget the fears and come here. The measurement is going to take less than a second, believe me. And being accurate, we can plot it every 3 months to know if there is a steady rise, plateau, or things are getting better. Thank you for listening to me.